have today here in the United States of America. None of you have raised your hands. Why have none of you raised your hands?
Because I lived under it for 4 years and it was awful.
Okay. Where did you live under it?
Scotland.
Okay. What was awful about it?
If you needed an operation, it would be scheduled. Not necessarily this year.
Okay. Do you know that recently Scotland, Great Britain, the entire Great Britain have changed that program to where it takes no more than 6 months to get an operation scheduled, that is an elective operation, to where a required operation can be scheduled within weeks or as much as a month or two. Do you know that most people who live in those countries are satisfied, more satisfied with their healthcare programs than Americans are? I'll cite you some statistics to follow up what I have to say and why I believe this country needs single-payer healthcare systems. In the first place, it is not socialized medicine. Socialism means the government runs the program. The government does not run the program that is being recommended by our present government. The program is only provided government support, but it will be run by private healthcare professionals and private insurance companies. How many of you are in an HMO, health maintenance organization? If you are, you're restricted. You can only see a certain group of doctors, the ones that are in the HMO. With universal healthcare, you can go to any general practitioner you want to go to. You are not restricted by your program. The United States currently ranks 23rd in infant mortality amongst the countries of the world. In 1960, we were at number 12. The United States ranks 20th in life expectancy for women. In 1945, we were first. The United States ranks 21st in life expectancy for men. In 1945, we were first. The United States has other problems that I won't go into because I want to move on to something a little bit beyond that. When we talk about a variety of diseases such as coronary artery disease, renal failure, we rank below Canada, Great Britain, Germany, France, and several other countries. All of those countries have some form of single-payer, or in the case of Germany, dual-payer health insurance programs. And the reason Germany has dual-payer is because they have two programs, one called AOK and one called DAOK. One is for self-insured, self-employed, and the other is for employed. But they do the same basic thing. The other thing that people don't recognize, if you've got the money, you can have private health care. Have your own private doctor. You don't have to be in the single-payer system that's designed to help those who need it the most. Because the people who need health care the most are the ones that don't get it. The poor, the uninsured. Or if they do get it by going to the emergency room because they don't have an alternative. And then we pay for it. As you heard from me last week, I have a doctor that lives across the street from me. He estimates that 40% of his caseload is people who are uninsured, and he doesn't get paid for it. He spends most of his time working billing instead of seeing patients. That's the other difference. A single-payer system has lower administrative costs than our current system in America. We spend 30% of our dollars on administrating the healthcare system that we have in this country. Medicare only pays 3% for administration. Medicare is a single-payer system. Now, I said, if you're in a single-payer healthcare system, you can see whoever you want to see. There are problems, and I will admit to them in any way, shape, or form. There are always problems in any system, problems that need to be solved. In Germany, for example, you may have an appointment at 11 o'clock in the morning, but you might not get seen until 1 o'clock in the afternoon. That been estimated that in our country, we have 15 to 20% more doctors than we would need under a single-payer system. Our system would not be overburdened in the same way if the same doctor-to-patient ratio exists that exists in our country today. The problem we have today is not that we don't have enough doctors, is that they're spending too much time on administrative practices because of the insurance companies that control our healthcare system. And they control it from one end to the other. Look at what happened to the prescription drug program for Medicare. It was the insurance companies that determined how it would be put together. And it's not the best program we could possibly have. Studies have shown that citizens in universal healthcare systems have more doctor visits and more hospital stays than here in this country. Comparison difficulties accessing care are shown to be greater in the U.S. than in Canada, believe it or not. And my brother is in the Canadian system, although he lives in Las Vegas because he worked for the Canadian Embassy in Los Angeles for several years. So he's under the Canadian program. So to summarize, under a universal care system that's being proposed, or at least the major programs that are being proposed, a single-payer system will give us greater access to the medical professional, will not cost more, will probably cost less. That's another of our problems. We pay more than 30% more for our medical care than all the other major countries in the developed world. And a single-payer system would help the people who need it the most.